Hello, and thank you for joining us for one of 3 podcasts about kidney transplantation. Today, our special guest is Timmy Nelson, who's going to share his thoughts on transplant from the patient's perspective. My name is Jerome Bailey, and I'm the Associate Director of Patient and Family Engagement with the End Stage Renal Disease National Coordinating Center. We partner with patients, healthcare providers, and the Centers for Medicare and Medicaid Services, also known as CMS, to create and share resources that help kidney patients improve their quality of life. According to the United Network for Organ Sharing, kidney transplant is the most common organ transplant surgery performed. In this surgery, kidneys that are not working are replaced by a kidney from an organ donor, living or deceased. If the transplant is successful and the kidneys continue to work, the recipient no longer requires any kind of dialysis. There are more than 100,000 Americans thriving today with a donated kidney. Our guest today, Timmy Nelson, was diagnosed with kidney failure in 2013. He received a kidney transplant from a deceased donor in 2017. After retiring from the United Parcel Service after 38 years of service, Mr. Nelson now volunteers his time educating patients about their kidney disease treatment options, including transplant. Mr. Nelson, may I address you as Timmy?
Yes, please do.
Welcome to the podcast. How did you first hear about kidney transplant as a treatment option for kidney failure?
My first visit to my nephrologist, we talked about a quandary of things, and he concluded the conversation with suggesting to me that the optimal treatment for me is going to be a transplant.
How and when did you decide that it was something you wanted to pursue?
Well, once again, I had a great nephrologist. He educated me on all the avenues for dialysis and how that process worked. But he explained to me also that there is no total treatment for kidney failure. But he said the best option for me to manage this disease I have wouldn't be a transplant. We talked about how that process would work. We talked about what I would need to do afterwards as far as aftercare, as far as my immunosuppressants that I need to take. And so at that point, there was no decision for me otherwise than to seek a kidney transplant.
What was the role of the dialysis facility staff in the process of becoming listed and maintaining an active listing status?
Once again, I've come myself very fortunate. The staff that I work with walked me through the entire process for dialysis, first of all, but then they were also totally supportive as far as what I need to do for a transplant. And they also shared the same comment with me that our goal is to not just maintain you on dialysis. Our goal is, if you're willing to do so, is to prepare you for a kidney transplant. And so in addition to talking about my treatment for dialysis, they also talked to me about healthy things that I need to do to maintain my health, things as far as eating properly, as far as taking the medication I need to take, as far as having a decent exercise regimen to make sure that I did all the things I need to do to get prepared for that first evaluation.
What were some of the challenges you faced getting on the transplant wait list?
There really weren't no challenges for me that I can think of. In my mind, the biggest challenge was me to make sure that I was the best possible candidate. And so I took to heart everything that I was shared with my professionals. They're professionals for a reason, and if I'm going to treat with them, I need to listen to them. And I took every piece of advice they gave me and followed it to the letter.
Did you ask any relatives or close friends to be a living kidney donor?
I did, and I struggled with that, and here's why I struggled with that. My mother also passed away from kidney disease at an early age, and I was diagnosed at 57. She passed away in her early 60s. So around the same time she got diagnosed, I got diagnosed. And they really have not been able to determine totally why my kidneys failed is something genetic, something hereditary. And so my fear was, with my 4 children, first of all, my fear was to have them become a donor. And they were all willing. In fact, they all got tested. I was concerned about that, though, because for me personally, if one of my children would have had the same issue as they got later in life, then, the toll on me mentally would have been probably more than I wanted to bear. So I chose not to have my family members to become donors. or to strongly consider being donors. And after I got adjusted on my life as a PD patient, I kind of accepted the notion that if this is my destiny, I can manage this.
So what was the conversation like when you told your kids that you would not be accepting a kidney from them?
Well, I have 4 children, and like me, they're very strong-willed, and so that was not an easy conversation. There was a lot of opposition, and it got to a point where I said, look, I love you all, but that's something that at this point in time I cannot see me doing. So let's table that conversation. But I also assured them that I was in very good health considering my kidney disease, and I was doing everything I needed to do. So that relaxed them a little bit to know that their dad was doing all the things he needed to do. So they still were adamant about it, and today, in fact, I talked to my oldest son recently, who was a perfect match for me, and he said, Dad, I said, you know what, I understand, but that's not something I wanted to do. So, but it was a difficult conversation, but I think I made the right call in the long run.
Tell us about the experience of getting the call that a kidney was available for you.
When you talk about euphoria, that was probably one of the greatest points in my life, to be honest with you. As I mentioned, I had decided that if for some reason I could not get a kidney transplant, I was able to manage my life on dialysis. And once again, I managed it. I didn't let dialysis manage me. I did all things I was supposed to do, but I built it into my lifestyle. But we were preparing to go to a family reunion, and we got the phone call, and they shared with us that they found a kidney that was a perfect match for me. However, I was the number 4 person in line for that kidney, but they would keep me posted throughout the next couple of days. And so every 10 to 12 hours, I received a phone call. After that second phone call telling me that I was no longer number 4, I'm now number 3, I canceled my plane tickets to Kansas, which is where my reunion was that year. And I said, I'm going to take the chance that this kidney might be here for me. And it turned out it was. When I got that last phone call, it's telling me that, okay, the kidney's yours, you need to get here. Excitement, answers to my prayers, realization of hope coming true. I guess that's the best way to describe it. And I've been euphoric since then, to be honest with you. It's every day is a blessing, and every day is an opportunity for me to share my story with others with the hope of giving them hope.
What were the biggest challenges in recovering from the surgery?
You know, the biggest challenges were just understanding what I needed to have done. And I don't really want to call them challenges because, as I mentioned, I'm very disciplined, and I feel as though professionals are in my life for a reason. If I'm going to listen to what they say, I need to follow what they say. And so the greatest thing that the professionals shared with me was to maintain my diet, to of course maintain my medication, but also to start getting more and more exercise. And in this case, it's a matter of walking. So probably one of the greatest challenges was me realizing that day after surgery, I need to start walking. Now, I wasn't walking very fast at first. In fact, I was thinking, how can I be walking right now? I just had major surgery. But the 3 days I was in the hospital, after day 1, day 2, and day 3 got easier and easier. And, of course, I continued that once I went home. But that was probably the greatest challenge, if you want to call it a challenge. But it's just a matter of following the instructions. And I guess I'm stressing that, but it's so important that any time you're talking to medical professionals about your personal health, that they're giving you advice for a reason. I think it's so important to make sure that you adhere to that advice.
Who was your care partner after the surgery?
My wife was my care partner, and Lorraine did a great job. I tell you what, I have constant praise for her, how she nursed me through this process, because, of course, there's things that you just can't do afterwards. And in fact, through the entire dialysis process, she was right by my side every step of the way, totally supportive. May have disagreed with some things that I wanted to do or things that I wouldn't do, for instance, like my kids being possible donors. But totally supportive every step of the way, and I tell you what, I owe her a great debt of gratitude.
How important was having a care partner with you after the surgery?
I am, once again, a very strong-willed person, and I mean that in a positive way. I mean, I'm not a raving lunatic, so to speak, but I'm a very strong-willed person. And was a time in my life where I had to realize that I could not do things on my own. And to have a care partner that was totally focused on what you need and also understood that how difficult it was for me to ask for help. It got to a point where that she was like a mind reader. She knew the things I needed to do. She could tell when I wasn't feeling well. She could tell when I was having mental anguish, and we would get involved in conversations. It was as though she was inside my mind, and she could read my mind as to the things that I needed. So that care partner is so important because it's not just for them to take you back and forth to the doctor, but this becomes the person that you share your concerns with, a person that they really, if they're focused on you, they can read what you need many times before you need it. So the care partner is a huge key for this process, because without a good care partner, it would be very, very difficult, if not impossible.
What have been the benefits of having a new kidney?
I tell you what, I call it a new lease on life. And it's fortunate the organization that secured my kidney is called Gift of Life, and that's exactly what it is. Because without having a functioning kidney, as I mentioned before, I managed, and I didn't let my kidney disease control me. I managed it. But having a new functioning kidney has given me the opportunity to do things better than ever before. It also makes me very conscious of my need to give back and hopefully support others, because I know what it's like to be in the world of dialysis and to live that life. And so when I talk with patients, I share with them the need for them to do things that they need to do to become the best possible candidate for a kidney transplant. But then I also share with them, after the transplant, post-transplant, you've got to make sure you do all you can to make sure that you maintain that kidney. So the best thing for me is to, each day I think about what a blessing it is for me to have received a kidney, and also this presents me an opportunity to share with others.
Was there anything that surprised you?
You know, I was surprised about how quickly I recovered. And I in my mind, when he told me about 3 weeks before I'd be able to drive again and kind of do things on my own, in my mind, I'm thinking, this is a pretty major surgery. How can you have an incision like this and have a major surgery like this and be up and mobile in about 3 weeks? Well, I surprised myself on that too, because after about 2.5 weeks, I was released. They said, you're ready. You're all set. I mean, everything, you've done what you're supposed to do, and so you beat the projected time by half a week. And that's been my goal with everything that I've done with this whole process, though, is to be the best possible patient I can be, because, again, those medical professionals are in my life for a reason, and I need to listen to what they say. So I was surprised about that, but when I look back on it and I talk with the medical professionals that took great care of me, I'm not as surprised, because if you do what they tell you to do, your chances of recovery are great.
So what advice would you give to someone thinking about getting on the transplant wait list?
The couple of things that I would share with the patient that they're not exceptions to the things you must do. The first thing is you must maintain your current dialysis prescription. Everything that you need to do to maintain a good, healthy lifestyle on dialysis, taking your medication, eating right, not drinking excessive fluids, getting exercise, those are the things that you must do to get prepared for that transplant. Because in my case, my first evaluation, my coordinator shared with me that based on the results that they saw from my first evaluation, that I was a great candidate there and that day. So then, but they also shared with me, you're a great candidate now. Now your goal is to become an even better candidate. So each day I woke up with the focus of, what do I need to do to make myself a better candidate than I am already? So what I would tell a person considering transplant, stick to your dialysis prescription 100%, take your medications like you're supposed to, eat like you're supposed to, drink like you're supposed to, and then also the exercise thing like you're supposed to. And then after you get that transplant, maintain that regimen. You've got to make sure you do everything that you're asked to do to help maintain that kidney.
Timmy, it's been a pleasure to speak with you today. We are grateful for your time and dedication to improving the quality and experience of care for all of those touched by kidney disease. Thank you. We thank you for listening to this podcast. To listen to the rest of our podcast series on transplant or for additional information on the kidney transplant process, visit the End Stage Renal Disease National Coordinating Center website at www.esrdncc.org or talk to your healthcare provider.